What does a PVC mean?
Well, a PVC is a premature ventricular contraction, and it's an extra beat. So again, the heart, upper chamber, lower chamber, upper chamber. Then if the lower chamber throws in an extra beat, that's a PVC.
Can you see that on electrocardiogram?
You can, yes.
And the activity that comes to the electrocardiogram, the beat is coming from the muscle, but it puts out electrical current?
That's right, that's exactly right. And you can see that as an extra spike on the electrocardiogram.
Now, that's a premature ventricular. What is the ventricle?
That's from the lower chamber, the pumping chamber.
That's the big pump.
Right.
How about an atrial premature contraction?
Right, that's when the extra beat comes from the upper chamber. So an extra beat can be thrown in from the upper chamber or the lower chamber.
So how does the patient feel if they've got an extra beat, a PAC, premature atrial contraction, or premature ventricular? How does the patient feel? Do they know it sometimes?
Well, oftentimes people feel like their heart skipped a beat. So if they can sense their heartbeat, they feel like they actually missed a beat, and that afterwards the heart comes back strong.
Because it has longer to fill?
That's exactly right.
So it's pumping out more blood right there. But so there's a long pause after that extra beat where the heart really can fill up.
That's right.
How do you know if it's dangerous or not dangerous?
Well, that's a very good question, and that's something that actually the physician helps to figure out. I would say we're more worried about dangerous heartbeats for somebody with heart disease, like somebody that's had a previous heart attack, and if the episode caused the person to faint or black out or pass out or collapse.
Now, how about if I occasionally feel an extra beat, but when I exercise, get my heart rate going, it goes away, versus if I exercise, I feel more of them?
Right. In the first case, when you exercise, if the extra beats go away or smooth out with exercise, that's good. That's a good finding. If it gets worse with exercise, that can be a serious finding.
And if it's worse, then you have to go further on in the workup. Is the treatment of, if it evens out and you don't think it's something abnormal, do you just assure the patient?
Yes. There are medications. For example, there are medications called beta blockers that block adrenaline, and so it buffers the heart from the adrenaline or epinephrine in the system. But for a benign extra beats, we usually do not give those medications.